The next speaker is the Honorable Frank Anthony.
Mr. Speaker, honorable members, I rise to add my voice to the budget debates. But before doing so, sir, allow me to extend my congratulations to you as Speaker of this House. I trust that through your leadership and guidance that we will see the strengthening of parliamentary democracy in Guyana. Mr. Speaker, agriculture is one of the pillars of our economy, and we have just heard from the Minister of Agriculture. And I have had the opportunity to peruse a document that was produced by the People's Progressive Party Civic Government from 2013 to 2020, a national strategy for agriculture in Guyana. And according to this document, sir, it says on page 11 that agriculture contributes about 20% of our economy, and agriculture today also accounts for more than 33% of the employment of our country. Almost 40% of Guyana export earnings come from agriculture. And as we have heard from the Minister, a major part of those earnings come from sugar and rice, two pillars in agriculture. Mr. Speaker, perhaps with the exception of the first peoples of our country, most of our ancestors were brought here because of sugar, coffee, or cotton. The records will show that as early as the 14th of May, 1637, the Dutch West India Company was exporting sack sugar from the Essequibo, which means that we were exporting sugar for at least 378 years. And from then to now, we have had our ups and downs in the sugar industry. And we have emerged from every challenge stronger than before. And I am confident that the issues confronting the industry today can be surmounted. But to do so, we must work together. The Minister of Finance said on page 9 of his budget speech that the implications of this industry remaining uncompetitive producer are frightening. Indeed, thousands of workers are afraid. On the estates, there's a lot of murmurs, rumors. People are uncertain about the government's policy and what the future holds for the industry. They know that a sugar commission was established. They, the workers and the stakeholders in this industry, would like to be consulted. They are hopeful. They don't want to hear the bitter news of closure or privatization, but rather they want the better news of sticking with a plan to turn around the sugar industry. The Honorable Komal Chan has outlined a number of measures for the sugar industry. These are not just a wish list. It is a set of pragmatic measures to return the industry to profitability. I will urge that they be taken very seriously. Mr. Speaker, a few of us were born and raised on sugar estates. We understand what it is to be a sugar worker's child. We understand what it is and the hardships that people on the sugar estate would have to go through. And we want to say that if the sugar workers were to lose their jobs, that the social and economic dislocation that would happen in this country would be catastrophic. So, Mr. Speaker, Mr. Speaker, there are some things worth fighting for. There are some sacrifices that we have to make. And one of those sacrifices is that we must all work to save the sugar industry. Our commitment to protecting the industry must be absolute on both sides of this House. And let us send a clear and unambiguous statement that we will protect this sugar industry. Mr. Speaker, I now turn to an area which I'm covering, and that is in the area of health. We all would agree that a healthy population is a tremendous asset to our nation's development. And over the years, the People's Progressive Party civic government have worked consistently to improve the well-being of our people. The latest strategy, Health Vision 2020, outlines the interventions that are necessary for a healthy nation. We note that the APNU AFC seem to have abandoned the vagueness of their manifesto and have adopted Health Vision 2020. Mr. Speaker, our list of accomplishments in the health sector are many, yet despite our achievements in health, there are some who suffer from don't acknowledge good or just attribute bad syndrome. A form, I would say, of selective amnesia. They behave as if the PNC did not have a past. And that is something, perhaps, that we need to remind them of. So to treat this condition of selective amnesia, I would like to prescribe a tablespoon of history. Mr. Speaker, in 1992, the World Bank issued a report, Guyana from Economic Recovery to Sustained Growth. It stated in 1991 that we spent 1.9% of our GDP on health. What did 1.9% of our GDP bought for us? With this expenditure, in this same report, it states our hospitals operate with most of the equipment not working, with no drugs to dispense, insufficient budgets for food, and the inability to carry out simple diagnostic tests, such as x-rays and blood tests. Mr. Speaker, I will deal with infant mortality. At the time, our public health system consists of 115 health posts, 47 health centers, 16 district hospitals, 4 regional hospitals, and a national referral hospital here in Georgetown. There were also some specialized hospitals in geriatrics, psychiatry, and in leprosy. But, Mr. Speaker, every one of these health facilities were in a state of disrepair. Today, we are proud that the public health system now consists of 212 health posts, 127 health centers, 22 district hospitals, 4 diagnostic centers, 5 regional hospitals, and a fully refurbished National Referral Hospital in Georgetown. And had it not been for our myopia in this House, and especially with members who are sitting now on the government side, we would have had a specialty hospital in this country. And the specialty hospital, I'll deal with it. I'll deal with it. I'll deal with it. Let me deal with it. In short, Mr. Speaker, we now have a sector that we have changed from 183 poorly maintained health institutions under the PNC, that we now have 373 better equipped, better facilities in this country. Yeah, and we are proud of it. We are proud of it. Mr. Speaker, let us talk a little bit about the health manpower at the time. And in page 88 of the said report from the World Bank, health manpower shortages are acute throughout the sector. The Ministry of Health report for 1990 shows that close to 40% of the staff positions are vacant. Clearly, these shortages profoundly affect the quality of health care offered. In 2014, according to the Minister's Jordan budget, in Appendix 1, when we look at that table, we can see that 13.3 physicians per 10,000 population. What does that mean? It is the first time in the history of this country that we have so many doctors operating in the public health system. In the same annex, we also have 30.5 nurses per 10,000 population. This too is at an all-time high. And I note that in the APNU AFC manifesto that they were saying that they would like to meet international standards. Well, I have some news for you. Because according to the World Health Organization, they say that for health personnel in a health system, you must have at least, or a minimum of, 25 persons, 25 health workers per 10,000 population. What it is now in Guyana, we have right now in Guyana, in our health system, the people who are maintaining this health system, we have 46 workers per 10,000 population. That is progress. That is progress. Mr. Speaker, we can go on. We can talk about filaria. When in the 1990s, filaria in this country was at an all-time high. Maybe people don't know what is filaria, but it's what is commonly referred to as Bigfoot. What did we do? When in the 90s, you could have seen a lot of people walking around with Bigfoot, but we have changed that. The early 90s, when you were the Minister of Finance, when you did not provide enough money for the health sector, that was what it resulted into. It resulted in people's health deteriorating. And you had a lot of people walking around with big foot. So, Mr. Speaker, then of the people who were tested, 16% of them were showing that they had filaria. In 2007, we, in the PPP civic government, we ran a campaign using deck salt. And because of that, you would have seen a massive reduction of filaria in this country. In fact, now, when you look at the annual reports of health, filaria now is something that don't show up. It's a very minor problem now, and that is because we have dealt with the problem.
We also have nitrogen in many different forms.
We can also talk about anemia. Anemia in pregnancy. Many of the women, when they're attending the health centers, many of them were diagnosed with mild or moderate anemia. And one of the things that we were able to do, we worked with the Inter-American Development Bank, and we had a $6 million basic nutrition program in this country. What was it that we addressed? We were able to address this problem of anemia in pregnancy. And what happened? We were able to reduce it drastically. Because before that, you had a lot of mothers, when they come to the health center, they were having these problems. And what did that lead to? It led to babies having low birth weight and other complications. We have been able to reduce this significantly. We also, through this program, would have worked to reduce malnutrition. Today, you can go on the wards in the Georgetown Hospital, or any hospital for that matter, and you would see very little malnutrition being present. We cannot say the same thing in the 90s. And if you go back to the report, you would see how many children were malnourished during that period. Mr. Speaker, this program was so significant, not only for Guyana. You know, the Secretary of the Treasury of the United States, I think Mr. Timothy Geithner, he had a special awards ceremony for the heads of various banking institutions, the World Bank, the IDB, and others. And for the IDB, they receive an award from the Department of Treasury of the United States. Why did they get that award? They got it for the basic nutrition program in Guyana because of its impact on the people here.
Of course, it's not important.
Mr. Speaker, we can also talk about vaccinations. In the 90s, what was happening? You had children being immunized with about 6 vaccines. Now we have more than 16 vaccines being given. That is progress, and that is what is helping to reduce infant mortality in our country. I'm very happy that the Honorable Minister of Health has done a turnaround, because I remember when he was sitting on the opposition benches, that one of the things that he did when he was speaking on these benches was that he seemed to be opposed to the HPV vaccine. And we can go back to 2 or 3 years ago when he made that speech. So, just about 2 weeks ago, I saw him with a representative of PAO WHO here in Guyana, and he was talking about HPV and how they're going to expand it. And I'm happy that he came around, because this is essential to prevent cervical cancer in Guyana. So, Mr. Speaker, there are many things that we can talk about in this sector. This did not happen, these achievements did not happen because of wishful thinking. And again, we can look at the Minister of Finance budget in Appendix 1, and we'll see how the People's Progressive Party civic government would have consistently increased the allocation to health. Using his numbers, we spent 6.8% of the budget in 2010, and by 2014, we were spending 9.9%. The Minister of Finance also proclaimed on page 38 of his budget that his government would invest significantly in health of our people to realize a successful implementation of Health Vision 2020. I wonder how significant is this investment when, as a percentage of the budget, it moved from 9.9% to 10.5%, a mere 0.5%. I guess this is the difference between rhetoric and reality. And then again, the Minister of Finance stated on the same page, emphasis will be placed on reducing health inequities, expanding primary health care, arresting non-communicable diseases, eliminating maternal and infant mortality, and providing universal coverage. These are beautiful words, and without funding are nothing more than politically correct platitudes. Isn't it ironic that the budget in which the Minister of Finance speaks of expanding of primary health care, he has contracted primary health care program by more than $81 million as compared to 2014. It is also instructive and perhaps reminiscent of a movie I saw many years ago called Honey, I Shrunk the Kids. Because when you look at the capital budget for health in the regions, they have shrunk it from $610 million in 2014 to $552 million.
Oh my goodness.
And let us examine it. Of the 10 regions, 7 of them got a decrease in their budget. The 3 remaining regions that show an increase in their capital budget, Region 1 got 26 million, and that's good, more than 2014. Region 8 got an increase of $163, more than 2014. And then Region 6 got an increase of $65, more than 2014.
Honorable member, you have 10 minutes remaining.
Thank you, Mr. Speaker.
So what? Your term said
So much for the rhetoric of expanding primary health care, Mr. Speaker. The Minister of Finance also talked about arresting non-communicable diseases. And I fully agree with him. Because if we can't arrest criminals, at least let us arrest chronic non-communicable diseases. Indeed, one of Guyana's biggest challenges is the burden of chronic non-communicable diseases. And of the top 5 causes of deaths, 4 of the chronic non-communicable diseases, there are 4 chronic non-communicable diseases in the top 5. Coronary heart disease, stroke, diabetes, HIV, and hypertension take the top 5. And the other 5 are suicide, road and traffic accidents, influenza and pneumonia, liver disease, and violence. Mr. Speaker, many of these deaths are preventable. And the Honorable Member, Dr. Cummins, in her presentation, she spoke about mental health, and in particular, about the plans for suicide. And this is commendable. But the mortality profile that I have outlined, we need to put more emphasis on the top 4 chronic non-communicable diseases. The mortality profile is the proverbial tip of the iceberg. When you look at the morbidity profile, we see how many thousands of persons are afflicted. The budget, what is the budget prescription? What is the budget's prescription? Restructuring of the Presidential Commission on Chronic Non-Communicable Disease. This will not arrest the problem of chronic non-communicable disease in Guyana. We need tangible actions to prevent people from getting sick and to make sick people better. To this end, I want to recommend to the Honorable Minister of Health that for each diabetic patient that we give them a glucometer and a year's supply of testing strips. And for those hypertensive patients, I would recommend that we give them a blood pressure apparatus and that we teach them how to use these 2 instruments, because these simple interventions can lead to better clinical management of these diseases. Mr. Speaker, we must also look at measures to reduce.
Could you also get around to time some nerve tonic?
Mr. Speaker, we must also look at measures to reduce road accidents and violence in our society. A substantial part of these deaths can be attributed to alcohol. And I crave the attention of the Honorable Minister of Public Security. The WHO statistics have shown that Guyanese have one of the higher rates of alcohol ingestion per capita. We are drinking 7.3 liters of pure alcohol per capita for persons 15 years and above. And this is quite unacceptable because the collateral damage that it does to a person's health and societal costs is extraordinary. We need, Mr. Minister, to develop programs to reduce this. We need preventative programs. We need treatment programs for those suffering from this addiction. And I don't think a 2 a.m. curfew is going to help us with this problem. We need to get out there and educate people. Mr. Speaker,
You have 5 minutes remaining.
however, I am not optimistic that much would be accomplished. And this is why regional and clinical services have shrunk from 5.9 billion in 2014 to 4.1 billion. Disease control has shrunk from 1 billion to 337 million. Rehabilitation services have shrunk from 256 billion to 206. Standards and technical services reduced from 524 to 408. Health sciences education from 484 to 317. I'm sorry for the Minister of Public Health because I don't know what he will do with this budget. It is a mismatch between the rhetoric that is in the budget and the monies that they have allocated. Mr. Speaker, the Minister of Finance spoke about eliminating, not reducing, eliminating maternal and infant mortality. Lofty ideas, but no country in the world has been able to accomplish that. And I'm hopeful that he would be able to do it because he has it in the budget. But what is the reality? Just 2 days ago, Carol Bolas, on the 10th of June 2015, died. And when we look over the last 3 months, there were 3 maternal deaths. It is not something that we are happy about, and this is something that we all have to work to reduce, because to do that, we have to put more money in the maternal unit.
Give the man something to work with.
And while I'm happy that we are going to finish off the maternal ward at the Georgetown Hospital, that alone is not going to be sufficient to reduce maternal mortality in this country. We have to do a sector-wide investment to make sure that we can deal with this problem. Mr. Speaker, one of the things that I would like to touch on, because it's very troubling to me in this Parliament, is an attitude that I have seen in this 11th Parliament. Yesterday, what did we witness? We saw a motion being presented. And what happened? We have reduced the time when we are able to ask questions on the estimate from a maximum of 7 days to 3 days.
Shame on the government.
Mr. Speaker,
Trying to
is
avoid
this good?
scrutiny.
Is this good for democracy? When the honorable members on that side, when they were on the campaign trail, what did they go to the people of this country and say? They were talking about national unity and the things that what they can do and what they will do to foster and create an enabling environment for national unity. And as soon as they have the opportunity to be in government, they have subverted and undermined the principles on which we can build this unity.
Honourable member, you have 2 minutes remaining.
Mr. Speaker, look at what has happened. Our independence celebration, the 49th independence celebration of our country was hijacked. Hijacked with party colors. All of a sudden a state event became a green and yellow event. A green and yellow event. Is this the way that we will build national unity in this country? Look at what they have done to the state boards.
Honourable member, you have 1 minute to wrap up.
Mr. Speaker, in that 1 minute, I want to say this. When the Honourable Minister of State, Mr. Joseph Harman, spoke, he spoke about the Red House. And it's good that he's saying it. But I also want to say something. We did not come to the Parliament and say that the Barnum family had gotten 22 acres of prime land, lease land. We did not come here and say that. And later on, the now opposition leader, when he was president, gave them 5 acres of freehold. 5 acres of freehold. So you know,
Honourable member.
we can disparage our presidents.
Honourable member, your time is up.
Thank you, Mr. Speaker.